Question 1. What is the most common cause of anemia in small animals and how is it typically treated? A. Excessive vitamin B deficiency, treated with oral supplements. B. Chronic blood loss, treated with blood transfusions and iron supplements. C. Renal failure, treated with diuretics and corticosteroids. D. Acute infectious disease, treated with antibiotics and supportive care. Answer. B. Chronic blood loss treated with blood transfusions and iron supplements. Explanation. Anemia in small animals can be caused by a variety of factors, but the most common cause in clinical practice is chronic blood loss. This can occur due to gastrointestinal ulcers, parasitic infestations, or chronic inflammatory conditions that lead to continuous blood loss over time. The treatment often includes blood transfusions to stabilize the condition, along with iron supplements to promote red blood cell production. Chronic blood loss. This is often the result of ongoing internal bleeding, such as from ulcers, which causes steady depletion of red blood cells. The loss of blood over time may lead to gradual reduction in the animal's red blood cell count. Correct treatment. Blood transfusions are necessary to replace lost red blood cells and to stabilize the animal. Iron supplements help increase red blood cell production in the bone marrow. The other options are incorrect. Vitamin B deficiency is uncommon as primary cause of anemia and would be treated with vitamin supplementation rather than iron. Renal failure C can lead to anemia, but it is typically treated with erythropoiesis-stimulating agents rather than diuretics. Acute infectious disease D may cause anemia, but antibiotics alone would correct the underlying anemia caused by blood loss. Question 2. Which of the following is a critical step in the process of preparing an animal for anesthesia? A. Administering a pre-anesthetic sedative to reduce anxiety. B. Performing a thorough physical exam, including auscultation of the heart and lungs. C. Fastening the animal securely to the operating table. D. Monitoring blood pressure during anesthesia to assess sedation level. Answer. B. Performing a thorough physical exam, including auscultation of the heart and lungs. Explanation. Before anesthesia, a thorough physical examination is essential to assess the animal's overall health, including auscultation of the heart and lungs to detect any abnormalities. This step helps identify any underlying issues that could affect the animal's response to anesthesia, such as heart murmurs, lung disease, or other respiratory issues. Auscultation. Listening to the heart and lungs helps detect irregular heart rhythms, murmurs, or signs of respiratory distress, which could pose risks during anesthesia. Pre-anesthetic sedatives are commonly used but are not as critical as performing a physical exam to assess the animal's overall condition. Fastening the animal to the operating table C is basic procedural step but does not assess the animal's medical readiness. Monitoring blood D is crucial during anesthesia but is part of the management during the procedure rather than the preparation phase. Question 3. Scenario-based. Mr. Thompson brings in his 7-year-old golden retriever, Buddy, who has been experiencing difficulty urinating. Upon examination, you suspect urinary obstruction. What should be your immediate course of action? A. Perform a catheterization to relieve the obstruction immediately. B. Administer pain medication and advise Mr. Thompson to monitor Buddy's condition at home. C. Begin Romanoid therapy and prepare for imaging to confirm the diagnosis. D. Wait for further signs of distress before taking any action. Answer. C. Begin Romanoid therapy and prepare for imaging to confirm the diagnosis. Explanation. In cases of suspected urinary obstruction, immediate action is required to address the blockage and prevent further complications such as kidney damage or rupture of the bladder. The recommended immediate course of action is to begin intravenous Romanoid therapy to help flush out toxins, maintain hydration, and prepare for further diagnostics such as imaging, e.g., X-ray or ultrasound, to locate the obstruction. Romanoid therapy. This helps stabilize the animal's condition by ensuring proper hydration and flushing out toxins that may build up due to the urinary blockage. Imaging. It is essential to confirm the nature and location of the obstruction through imaging before attempting procedures like catheterization, as improper handling of an obstruction could worsen the condition. The other options are incorrect. Catheterization is sometimes necessary, but it should not be done until the nature of the obstruction is confirmed through imaging. Pain medication B is important for comfort, but the priority is to address the obstruction. Appropriate diagnostic and therapeutic interventions. Waiting for further signs of distress D is dangerous as it could lead to severe kidney damage, bladder rupture, or septic shock if not addressed immediately. Question 4. What are the key differences between A simple fracture and a compound fracture in veterinary orthopedic care, and how do the management strategies for these two types of fractures differ? A simple fracture involves an open wound, while a compound fracture involves bone exposed to the environment. Treatment involves conservative management for simple fractures and surgical intervention for compound fractures. B. A simple fracture occurs with minimal displacement of the bone, while a compound fracture causes significant displacement. Conservative management is effective for both types. C. A simple fracture is clean without damage to surrounding tissues, while a compound fracture results in broken skin and possible infection. Treatment involves surgical intervention for compound fractures. D. A simple fracture is easier to diagnose than a compound fracture. Conservative management works for compound fractures, while simple fractures require surgery. Answer: C. A simple fracture is a clean break without damage to surrounding tissues, while a compound fracture results in broken skin and possible infection. The treatment involves surgical intervention for compound fractures. Explanation: a simple fracture is characterized by a clean break in the bone without any damage to surrounding tissue, while a compound fracture is more serious because the bone breaks through the skin, increasing the risk of infection, complicating the healing process. Simple fractures, these can often be treated conservatively with splints, casts, and pain management, depending on the severity and location of the break. Compound fractures, these require more intensive intervention, including surgical repair to realign the bone and clean the wound to prevent infection. In many cases, the wound is irrigated and debrided to ensure proper healing and to avoid complications, osteomyelitis, bone infection. The other options are incorrect because they either mischaracterize the fractures or the treatment required. Question 5. When working with anesthetic agents in veterinary practice, why is it essential to monitor an animal's heart rate and blood pressure during surgery, and what are the consequences of neglecting this critical monitoring? A. Monitoring heart rate and blood pressure is essential only during induction. Failure to monitor after induction can lead to sedation overdose. B. Monitoring these parameters is necessary to ensure proper perfusion and oxygenation. Neglecting this monitoring could lead to cardiovascular instability, organ damage, and even death. C. Heart rate and blood pressure monitoring only needs to occur if the animal shows signs of distress. Otherwise, monitoring is not required. D. Heart rate and blood pressure monitoring during surgery is less important than monitoring oxygen levels and respiratory rate. Answer: B. Monitoring these parameters is necessary to ensure proper perfusion and oxygenation. Neglecting this monitoring could lead to cardiovascular instability, organ damage, and even death. Explanation: during anesthesia, maintaining the animal's heart rate and blood pressure is essential to ensure adequate tissue perfusion and oxygenation. The cardiovascular system must continue to function efficiently to supply oxygen and nutrients to organs, including the brain and kidneys. Monitoring heart rate and blood pressure. If these parameters drop too low, the animal could experience hypoperfusion, leading to organ failure. Consequences of neglecting monitoring. Failure to monitor these parameters could result in hypotension, shock, or even cardiac arrest. These issues can lead to severe complications such as renal failure or neurological impairment, and they can even be fatal if not promptly. The other options are incorrect because they either underestimate the importance of monitoring these parameters or misrepresent when monitoring should occur. Question 6. Mr. Carter brings in his dog, Daisy, who has a history of vomiting, lethargy, and abdominal pain. You suspect pancreatitis. What diagnostic tests should you prioritize to confirm the diagnosis, and what treatments are commonly recommended for this condition? A. Perform an ultrasound and abdominal x-rays. The treatment usually involves antibiotics and corticosteroids. B. Perform the serum amylase and lipase test to confirm pancreatitis. The treatment involves fluid therapy, pain management, and supportive care. C. Start with an abdominal biopsy and CBC analysis. Treat with surgical intervention and long-term antibiotics. D. Begin with fecal testing and urinalysis. Pain relief and dietary changes alone. Answer: B. Perform a serum amylase and lipase test to confirm pancreatitis. A treatment involves fluid therapy, pain management, and supportive care. Explanation: pancreatitis is an inflammation of the pancreas and can present with symptoms like vomiting, lethargy, and abdominal pain. The most reliable diagnostic tests include measuring serum amylase and lipase levels, which are elevated in pancreatitis cases. Additionally, ultrasound is used to confirm the diagnosis, but serum markers are typically prioritized for diagnosis. Treatment: The management of pancreatitis involves fluid therapy to prevent dehydration, pain management, usually opioids, and supportive care such as anthelmintics to control vomiting and nutritional support. The other options are incorrect because they either misrepresent the diagnostic approach or provide inappropriate treatments. Pancreatitis is not typically treated with antibiotics or corticosteroids unless secondary infection or inflammation is present. Question 7, scenario-based. Dr. Robinson is examining a 5-year-old cat Whiskers who has recently developed difficulty breathing, cyanosis, and a persistent cough. Upon physical examination, a heart murmur is detected. Based on these symptoms, Dr. Robinson suspects heart disease. What diagnostic steps should Dr. Robinson take next to confirm the diagnosis, and what treatment options are likely to be considered? A. Start with a chest X-ray and electrocardiogram to assess for signs of heart enlargement or arrhythmias. The treatment would include diuretics and ACE inhibitors. B. Perform an ultrasound of the abdomen to rule out kidney disease. The treatment would include antibiotics and corticosteroids. C. Begin with a fecal float and urinalysis to check for parasitic infection. The treatment would involve antiparasitic medications. D. Conduct skin biopsy to rule out systemic illness. The treatment would involve pain management and rest. Answer: hey, start with a chest X-ray and electrocardiogram to assess for signs of heart enlargement or arrhythmias. A treatment would include diuretics and ACE inhibitors. Explanation: Whiskers symptoms: difficulty breathing, cyanosis, blue discoloration due to lack of oxygen, cough, and heart murmur. Suggest heart disease such as congestive heart failure or hypertrophic cardiomyopathy. Chest X-ray. This will help assess for enlargement, pulmonary edema, or fluid accumulation in the lungs, which can result from heart failure. This can help detect arrhythmias, which are common in animals with heart disease. Treatment: if heart disease is confirmed, treatment often involves diuretics to remove excess fluid from the lungs and ACE inhibitors to improve heart function. The other options are incorrect because they focus on unrelated systems, such as the abdominal or gastrointestinal systems, and do not address the heart disease suspected in this scenario. Question 8. What is the importance of a balanced diet for cats with chronic kidney disease, and how does it differ from the nutritional management of healthy cats? A high-protein diet is recommended for cats with chronic kidney disease to maintain muscle mass. B. Cats with chronic kidney disease require a low-protein, low-phosphorus diet to reduce kidney workload and manage symptoms. C. Cats with chronic kidney disease should be given a high-fat diet to improve energy levels, while healthy cats should be on a low-fat diet. D. A diet high in carbohydrates is essential for cats with chronic kidney disease, while healthy cats should eat a low-carb diet. Answer: B. Cats with chronic kidney disease require a low-protein, low-phosphorus diet to reduce kidney workload and manage symptoms. Explanation: for cats with chronic kidney disease, CKD, dietary management is crucial to slow the progression of the disease and alleviate symptoms. A low-protein diet is recommended to reduce the workload on the kidneys and prevent the accumulation of waste products like urea. Similarly, a low phosphorus diet helps to reduce renal secondary hyperparathyroidism, which can occur due to impaired kidney function. Nutritional management for CKD. This may also include increased levels of omega-3 fatty acids to help manage inflammation and support kidney function. Healthy cats, on the other hand, do not require such restrictions, and a more balanced, protein-rich diet can support their overall health and energy needs. The other options are incorrect because they either misinterpret the dietary needs of cats with kidney disease or recommend inappropriate levels of nutrients. Question 9, scenario-based. A 6-year-old golden retriever, Max, presents with limping and signs of pain when palpating his left hip. The owner mentions that Max has had difficulty standing up after lying down. Based on these symptoms, what diagnostic tests should you prioritize, and what treatment options would you recommend? A. X-rays to assess for hip dysplasia or arthritis. The treatment would include non-steroidal, anti-inflammatory drugs, NSAIDs, and weight management. B. Ultrasound to check for joint effusion. The treatment would involve corticosteroid injections and exercise restriction. C. Blood tests to assess for systemic inflammation. The treatment would involve antibiotics and rest. D. Fecal analysis to rule out parasitic infections. The treatment would include antiparasitic medication and pain relief. Answer A. X-rays to assess for hip dysplasia or arthritis. The treatment would include non-steroidal, anti-inflammatory drugs, NSAIDs, and weight management. Explanation: Max's symptoms: limping, pain on palpation, and difficulty standing up after lying down. are typical signs of hip dysplasia or osteoarthritis, particularly in larger breeds like golden retrievers. X-rays, these are crucial for diagnosing hip dysplasia or detecting signs of arthritis such as joint degeneration or bone spurs. Treatment. Common approach includes NSAIDs to manage pain and inflammation and weight management to reduce stress on the joints. In some cases, physical therapy and joint supplements may be recommended to improve mobility and comfort. The other options are incorrect because they focus on unrelated diagnostic tests, treatments not typically used for joint issues like hip dysplasia. Question 10. In the case of a dog with suspected food allergies, what diagnostic approach is recommended to confirm the diagnosis and how is the condition typically managed? A. Begin with skin scrapings to identify external parasites. Treat with corticosteroids and dietary changes. B. Perform an elimination diet trial followed by food challenges. Treat by avoiding allergens and managing symptoms with antihistamines. C. Conduct a blood test for specific allergens. Treat with antibiotics and a grain-free diet. D. Start with radiographs to assess gastrointestinal abnormalities. Treat with CERT and dietary modifications. Answer B. Perform an elimination diet trial followed by food challenges. Treat by avoiding allergens and managing symptoms with antihistamines. Explanation. Food allergies in dogs are typically diagnosed through a dietary elimination trial where all potential allergens are removed from the dog's diet and a novel protein source is introduced. After a period of time, specific foods are gradually reintroduced. The food challenge to identify which ingredients are triggering the allergic response. Management. Once the allergen is identified, the most effective management strategy is to avoid the allergenic food. In addition, symptoms may be managed with antihistamines or other medications to control itching or inflammation. The other options are incorrect because they either misapply diagnostic methods, e.g., skin scrapings, blood tests, or suggest inappropriate treatments for food allergies. Question 11. What are the primary differences between feline asthma and chronic bronchitis in cats, and how should the two conditions be treated differently? A. Feline asthma is caused by bacterial infections, while chronic bronchitis is due to environmental irritants. The treatment for asthma includes corticosteroids, while chronic bronchitis is treated with antibiotics. B. Feline asthma is an inflammatory condition of the airways triggered by allergens, while chronic bronchitis is a long-term inflammation from irritants. The treatment for asthma includes bronchodilators and corticosteroids, while chronic is managed with anti-inflammatory drugs. C. Feline asthma involves acute respiratory distress, while chronic bronchitis is always asymptomatic. Both conditions are treated with surgery. D. Feline asthma is often accompanied by coughing and wheezing, while chronic bronchitis causes excessive nasal discharge. The treatment for both conditions includes antiviral medications. Answer B. Feline asthma is an inflammatory condition of the airways triggered by allergens, while chronic bronchitis is a long-term inflammation from irritants. The treatment for asthma includes bronchodilators and corticosteroids, while chronic bronchitis is managed with anti-inflammatory drugs. Explanation. Feline asthma is an inflammatory condition where the airways become constricted due to allergens or irritants, leading to wheezing, coughing, and difficulty breathing. Bronchodilators, to open the airways, and corticosteroids, to reduce inflammation, are commonly used for treatment. Chronic bronchitis is a long-term inflammation of the airways, usually caused by chronic exposure to irritants such as smoke, dust, or environmental pollutants. It is treated primarily with anti-inflammatory drugs, such as corticosteroids and bronchodilators for symptom relief. The other options are incorrect because they miscarried the causes and treatments of the two conditions. Question 12, scenario-based. A 7-year-old Doberman Pinscher Duke is brought in for a routine exam. Upon auscultation, the veterinarian hears a murmur and suspects a heart condition. Duke is not showing any signs of distress, but the owner is concerned. What diagnostic steps should be taken to determine the severity of the condition, and what are the common treatment options for heart murmurs in dogs? A. Perform an electrocardiogram and chest X-rays. The treatment typically involves ACE inhibitors, diuretics, and possible beta blockers. B. Begin with a blood test for systemic inflammation. A treatment would involve antibiotics and steroids. C. Start with an abdominal ultrasound to check for organ abnormalities. To treat with diuretics and a low-salt diet. D. Conduct a skin biopsy to rule out systemic illness. To treat with management and rest. Answer A. Perform an electrocardiogram. chest X-rays. The treatment typically involves ACE inhibitors, diuretics, and possible beta blockers. Explanation: in dogs with heart murmurs, diagnostic steps such as an echo and chest X-rays are essential to assess the cause of the murmur, e.g., mitral valve disease, heart failure, and the severity of any heart enlargement or fluid buildup. This can detect arrhythmias or abnormal electrical activity in the heart. Chest X-rays. These help evaluate heart size and look for fluid buildup in the lungs, a common sign of congestive heart failure. Treatment: depending on the underlying condition, common treatments include ACE inhibitors to relax blood vessels and reduce heart strain, diuretics to reduce fluid buildup, and beta blockers to control heart rate and rhythm. The other options incorrect because they do not address the cardiovascular nature of the problem or provide appropriate treatments for heart murmurs. Question 13. A 5-year-old Labrador Retriever, Daisy, has been diagnosed with a torn cruciate ligament in her right hind leg. The veterinarian has discussed surgical repair as an option. What factors should be considered when determining if surgery is the best course of action, and what are the potential complications associated with this surgery? A. Daisy's age and overall health. The degree of lameness and owner preference should be considered. The potential complications include infection, blood clots, and knee stiffness. B. Only Daisy's age is important. The surgery should be avoided for dogs older than 5 years old due to the high risk of anesthesia. C. The severity of the injury is irrelevant. A surgery is recommended for all dogs regardless of the condition. D. Daisy's breed should be the prime factor in determining treatment. The complications include excessive bone growth and joint instability. Answer A. Daisy's age and overall health. The degree of lameness and owner preference should be considered. The potential complications include infection, blood clots, and knee stiffness. Explanation: when determining whether surgery is the best course of action for a torn cruciate ligament, multiple factors need to be considered. Daisy's age and health. Older dogs or those with concurrent health problems may have a higher risk of complications. Degree of lameness. Lameness or difficulty using the affected leg may make surgery more necessary. Owner preference. Some owners may prefer non-surgical management, which may be appropriate for less severe cases. Complications. Like any surgery, infection, blood clots, and knee stiffness are possible complications. Proper post-operative care can mitigate these risks, but they remain a consideration. Question 14. A 2-year-old Siamese cat, Felix, has recently been diagnosed with feline hypothyroidism. The veterinarian is considering medical management with methimazole. What are the expected benefits and risks of using methimazole for this condition, and what other treatment options are available? A. Methimazole can reduce thyroid hormone levels and alleviate symptoms like weight loss, but it may cause side effects such as vomiting and liver damage. Other options include surgical removal of the thyroid gland and radioactive iodine therapy. B. Methimazole increases thyroid hormone production, which helps to treat hypothyroidism, but it has no significant risks. Surgery is not recommended. C. Methimazole is ineffective in cats with hypothyroidism. The only treatment option is radioactive iodine therapy. D. Methimazole is primarily used to increase thyroid hormone levels. It is rarely effective in managing hypothyroidism. Surgery is always preferred over medication. Answer A. Methimazole can reduce thyroid hormone levels and alleviate symptoms like weight loss, but it may cause side effects such as vomiting and liver damage. Other options include surgical removal of the thyroid gland and radioactive iodine therapy. Explanation: feline hypothyroidism is a common endocrine disorder in older cats. Methimazole is a commonly used antithyroid medication that reduces the production of thyroid hormones, helping to alleviate symptoms such as weight loss, increased appetite, and restlessness. Benefits: methimazole can successfully manage symptoms, providing relief in many cats. Risks: potential side effects include vomiting, lethargy, and liver damage, which necessitate monitoring during treatment. Other treatments. Alternative options for more permanent management include surgical removal of the thyroid gland or radioactive iodine therapy, which is often the treatment of choice for long-term control. Question 15, scenario-based. A 3-year-old Yorkshire Terrier, Toby, has been diagnosed with intervertebral disc disease after presenting with signs of back pain and hind limb weakness. What diagnostic test would you recommend to confirm IVD, and what is the expected treatment approach for a dog with this condition? MRI ET scan to assess the severity of disc herniation. The treatment includes pain management, anti-inflammatory medications, and, in severe cases, surgery. B. X-rays alone to rule out fractures. The treatment involves immediate surgery to remove the affected disc regardless of severity. C. Blood tests to check for infection. Treatment includes antibiotics and exercise restriction. D. Fecal analysis to rule out parasites. The treatment includes deworming and pain relievers. Answer: A MRI ET scan to assess the severity of disc herniation. Treatment includes pain management, anti-inflammatory medications, and in severe cases, surgery. Explanation: intervertebral disc disease (IVD) occurs when the discs between the vertebrae in the spine herniate or degenerate, causing pain, weakness, or paralysis, particularly in small dog breeds like Yorkshire Terriers. MRI-ET scans are the gold standard for diagnosing IVD because they provide detailed images of the discs and spinal cord, helping to assess the degree of herniation or damage. Treatment: in many cases, conservative management with pain relief, e.g. NSAIDs or opioids and anti-inflammatory medications is effective. However, if the condition is severe and the dog has significant neurological deficits, surgery may be necessary to remove the herniated disc material and decompress the spinal cord. The other options are incorrect because they either suggest inappropriate diagnostic methods or irrelevant treatments for ID. Question 16. What is the primary difference between primary and secondary hypothyroidism in dogs, and how is each type diagnosed and treated? A. Primary hypothyroidism is caused by a thyroid gland defect, while secondary hypothyroidism is due to a pituitary gland problem. Of both types are diagnosed with blood tests measuring thyroid hormone levels, and treatment includes lifelong thyroid hormone replacement therapy. B. Primary hypothyroidism is due to an autoimmune disease, while secondary hypothyroidism is a result of dietary deficiencies of both types, diagnosed with a physical examination, and treatment includes dietary supplements. C. Primary hypothyroidism is caused by a viral infection, while secondary hypothyroidism occurs due to an overactive thyroid. Primary hypothyroidism is treated with antibiotics, and secondary hypothyroidism is treated with surgery. D. Primary hypothyroidism affects older dogs, while secondary hypothyroidism affects younger dogs. Types are diagnosed through radiographs, and treatment includes a combination of steroids and pain relievers. Answer A. Primary hypothyroidism is caused by a thyroid gland defect, while secondary hypothyroidism is due to a pituitary gland problem. Of both types are diagnosed with blood tests measuring thyroid hormone levels, and treatment includes lifelong thyroid hormone replacement therapy. Explanation: primary hypothyroidism occurs when the thyroid gland is damaged, often due to autoimmune destruction, leading to insufficient production of thyroid hormones. Secondary hypothyroidism is caused by the pituitary gland problem, which fails to produce enough thyroid-stimulating hormone (TSH), leading to low thyroid hormone levels. Diagnosis: both types are diagnosed with blood tests that measure levels of thyroid hormones (TT8) and assess gland function. Treatment: both types are treated with lifetime thyroid hormone replacement therapy, typically in the form of levothyroxine. The other options are incorrect because they either misinterpret the causes or diagnostic methods for hypothyroidism. Question 17. Scenario-based. A 10-year-old boxer dog, Rocky, has developed a noticeable cough, exercise intolerance, and has been breathing heavily even while resting. His heart rate is elevated and his abdomen appears distended. The veterinarian suspects heart failure. What diagnostic tests would you recommend, and what treatment options are available for heart failure in dogs? A. X-rays and echocardiography to assess heart size and function. The treatment involves ACE inhibitors, diuretics, and possibly beta blockers. B. Blood tests to assess liver function. The treatment includes antibiotics and pain relievers. C. Skin biopsies to check for autoimmune disorders. The treatment includes immunosuppressive drugs. D. Urinalysis and fecal testing to rule out systemic infections. The treatment includes steroids and restriction. Answer A. X-rays and echocardiography to assess heart size and function. The treatment involves ACE inhibitors, diuretics, and possibly beta blockers. Explanation: heart failure in dogs, particularly older ones like Rocky, often results from diseases such as mitral valve disease or dilated cardiomyopathy, leading to fluid accumulation in the lungs and abdomen, as seen in Rocky's symptoms: coughing, distended abdomen. X-rays help evaluate the size of the heart and the presence of fluid in the lungs, while echocardiography assesses the heart's function, including valve performance and pumping ability. Treatment: common treatments include ACE inhibitors, which reduce blood pressure and the workload on the heart, diuretics, to remove excess fluid, and beta blockers to reduce heart rate and improve heart function. The other options are incorrect as they do not address the cardiac nature of the problem. Question 18, scenario-based. A 4-year-old golden retriever, Max, has been diagnosed with atopic dermatitis after showing signs of itching, hair loss, and skin inflammation. The veterinarian suspects environmental allergies as the cause. What diagnostic tests should be conducted to confirm the diagnosis, and what treatment options should be considered? A. Skin scraping and bacterial culture. A treatment involves topical antibiotics and steroid creams. B. Intradermal skin testing or serum allergy tests. A treatment includes antihistamines, corticosteroids, immunotherapy, and possible environmental management. C. Fecal analysis and radiographs. A treatment includes deworming and rest. D. Blood tests for thyroid function. Treatment includes thyroid hormone replacement and diet modification. Answer B. Intradermal skin testing or serum allergy tests. A treatment includes antihistamines, corticosteroids, immunotherapy, and possible environmental management. Explanation: atopic dermatitis is a common condition in dogs that results from environmental allergies, often to pollens, dust mites, or mold. Diagnostic tests: intradermal skin testing or serum allergy tests are the most effective methods to identify the specific allergen causing the dermatitis. Treatment: this typically involves antihistamines to reduce allergic reactions, corticosteroids for inflammation, immunotherapy, allergy shots or oral drops to desensitize the dog to specific allergens, and environmental management, e.g., reducing exposure to known allergens. The other options are incorrect because they either target the wrong conditions or fail to address the allergy aspect of the disease. Question 19. A 7-year-old domestic short-eye cat, Luna, has been diagnosed with chronic kidney disease (CKD) after presenting with increased thirst, urination, weight loss, and poor appetite. What diagnostic steps should be taken to assess the severity of the disease, and what management strategies should be implemented to improve her quality of life? A. Urinalysis and blood tests for creatinine and blood urea nitrogen bond. Management includes fluid therapy, prescription diets, and phosphate binders. B. X-rays and ultrasound to detect tumors. The management includes chemotherapy and radiation therapy. C. Fecal tests for parasites and liver enzymes. The management includes deworming and antibiotics. D. Bone marrow biopsy to check for anemia. Management includes transfusions and steroids. Answer A. Urinalysis and blood tests for creatinine and blood urea nitrogen bond. The management includes fluid therapy, prescription diets, and phosphate binders. Explanation: chronic kidney disease (CKD), a common condition in older cats, and it causes a gradual loss of kidney function, leading to symptoms such as increased thirst and urination, weight loss, and poor appetite. Diagnostic tests: a urinalysis and blood test, creatinine and blood urea nitrogen bond levels are crucial for assessing kidney function and the stage of CKD. Management: treatment often involves fluid therapy to maintain hydration, prescription diets that are low in phosphorus and protein to reduce kidney strain, and phosphate binders to control phosphate levels in the blood. The other options are not appropriate for diagnosing or treating CKD. Question 20, scenario-based. A 5-year-old Rottweiler, Diesel, has been diagnosed with hip dysplasia after presenting with lameness, difficulty rising, and pain in the hip area. What diagnostic tools would be most useful for confirming the diagnosis, and what treatment options should be considered to manage his condition? A. Blood tests for infections. The treatment involves antibiotics and rest. B. X-rays and possibly a cant to assess the severity of hip joint malformation. The treatment includes pain management, joint supplements, and surgery. C. Skin scraping to rule out fungal infections. The treatment includes antifungal medications. D. Fecal tests for parasites. The treatment involves deworming and exercise restriction. Answer B. X-rays and possibly a cant to assess the severity of hip joint malformation. The treatment includes pain management, joint supplements, and surgery. Explanation: hip dysplasia is a genetic condition in large dog breeds like Rottweilers that causes abnormal development of the hip joint, leading to joint instability, pain, and lameness. Diagnostic tools: X-rays are the primary diagnostic tool to assess the degree of hip malformation. They can may be used in some cases to get a more detailed image. Treatment: conservative management includes pain relief, e.g. NSAIDs, joint supplements, e.g. glucosamine, and weight management. In more severe cases, surgical options such as a hip replacement or femoral head-ostectomy may be considered. The other options are not relevant for diagnosing or managing hip dysplasia. Question 21. A 3-year-old Maine Coon cat, Oliver, has been diagnosed with feline lower urinary tract disease FLUT. He has been urinating frequently, sometimes with blood in his urine, and has been vocalizing in pain. What diagnostic steps should be taken to determine the underlying cause, and what treatment options should be considered? A. Urinalysis and urine culture to check for infection or crystals. The treatment includes antibiotics, pain management, and dietary changes. B. Blood tests for anemia and liver enzymes. The treatment involves blood transfusions and steroids. C. Fecal analysis for parasites. The treatment includes deworming and pain relievers. D. Skin scraping to check for mites. The treatment includes topical treatments and rest. Answer A. Urinalysis and urine culture to check for infection or crystals. The treatment includes antibiotics, pain management, and dietary changes. Explanation: feline lower urinary tract disease FLUT encompasses a range of conditions affecting the bladder and urethra, including urinary tract infections, UTIs, bladder stones, and idiopathic cystitis. Diagnostic steps: urinalysis and urine culture help to determine if there's infection or the presence of crystals or stones in the bladder. Treatment: the treatment may involve antibiotics if the UTI is present, pain management, e.g. anti-inflammatory drugs, and dietary changes to dissolve crystals or prevent recurrence. In some cases, stress reduction and increased water intake may also be recommended. The other options are not applicable for diagnosing or treating FLUT. Question 22, scenario-based. A 9-year-old Dachshund, Daisy, presents with signs of vomiting, lethargy, and a distended abdomen. The veterinarian suspects a gastric dilatation volvular (GDE) or bloat. What diagnostic tools should be used to connect GDV, and what emergency treatment is required to manage the condition? A. Blood tests to assess liver function. Treatment includes antibiotics and pain relievers. B. X-rays to confirm the twisted stomach. Emergency treatment involves immediate gastric decompression and surgery. C. Fecal tests to check for parasites. Treatment involves deworming and rest. D. Ultrasound to detect tumors. The treatment includes chemotherapy. Answer: B. X-rays to confirm the twisted stomach. Emergency treatment involves immediate gastric decompression and surgery. Explanation: gastric dilatation volvular (GDV), commonly known as bloat, is a life-threatening emergency often seen in deep-chested dog breeds like Dachshunds. It occurs when the stomach fills with gas and twists on itself, cutting off blood flow. Diagnostic tools: X-rays are used to confirm the diagnosis by the characteristic double bubble sign of a twisted stomach. Emergency treatment: the condition requires immediate gastric decompression, usually through a stomach tube or needle, followed by surgery to untwist the stomach and prevent recurrence. The other options are relevant for diagnosing or treat GE. Question 23, scenario-based. A 6-year-old bulldog, Winston, has developed a chronic cough that has worsened over the past few weeks. His owner reports that the cough is more pronounced during exercise and sometimes at night. Upon examination, Winston is overweight and his breathing is labored. What diagnostic steps should be taken to determine the underlying cause of Winston's cough, and what treatment options should be considered? A. Physical exam and blood tests for bacterial infections. The treatment involves antibiotics and corticosteroids. B. Chest X-rays and heartworm test. The treatment includes weight management, bronchodilators, and possible medications for heart disease. C. Endoscopy to check for foreign bodies. The treatment involves surgical removal and antibiotics. D. Urinalysis and fecal tests for parasites. The treatment involves deworming, hydration. Answer: B. Chest X-rays and heartworm test. The treatment includes weight management, bronchodilators, and possible medications for heart disease. Explanation: the symptoms described, including a chronic cough that worsens with exercise and at night, are suggestive of canine bronchitis or possibly heart disease, e.g. congestive heart failure. Diagnostic steps: chest X-rays can help identify lung conditions, including bronchitis, pneumonia, heart enlargement. A heartworm test is necessary to rule out heartworm disease, which can also cause coughing. Treatment: managing weight and improving overall fitness is critical. Treatment may involve bronchodilators to open the airways and diuretics or other medications for heart disease. Question 24. A 4-year-old Siamese cat, Lily, has been diagnosed with hypothyroidism after exhibiting symptoms of weight loss despite a good appetite, increased thirst, and hyperactivity. What diagnostic steps should be taken to confirm the diagnosis, and what are the treatment options available for this condition? A. Blood tests for thyroid hormone levels. A radioactive iodine scan, and treatment includes surgery to remove the thyroid gland or radioactive iodine therapy. B. Urinalysis and culture to check for urinary tract infection. Treatment includes antibiotics and dietary changes. See fecal exam for parasites. Treatment involves deworming and hydration. D. Chest X-rays and ultrasound for tumors. Treatment in chemotherapy. Answer A. Blood tests for thyroid hormone levels. 10. A radioactive iodine scan and treatment includes surgery to remove the thyroid gland or radioactive iodine therapy. Explanation. Hypothyroidism is common in older cats and results from an overproduction of thyroid hormones, often due to a benign tumor in the thyroid gland. Diagnostic steps. Blood tests measuring to thyroid hormone levels are used to diagnose hypothyroidism. A radioactive iodine scan can help locate the overactive thyroid tissue. Treatment. Treatment options include surgical removal of the thyroid gland, radioactive iodine therapy to target and destroy the overactive tissue, or medication to control hormone production. Question 25. Scenario-based. A 3-year-old Labrador Retriever, Charlie, presents with a sudden onset of limping and reluctance to move after an afternoon of intense play. He is not showing signs of fever or swelling, but the owner reports that the limping worsens after rest. What is the most likely diagnosis, and what steps should be taken to confirm the condition and manage Charlie's symptoms? A. Torn cruciate ligament. The treatment involves rest and possibly surgical repair. B. Lyme disease. A diagnosis confirmed through blood tests treated with antibiotics. C. Intervertebral disc disease, a confirmed MRI and treated with steroids and rest. D. Hip dysplasia, confirmed through X-rays and managed with pain relief and surgery. Answer A. Torn cruciate ligament. Treatment involves rest and possibly surgical repair. Explanation. A torn cruciate ligament is a common injury in dogs, especially large or active breeds like Labradors. Diagnosis. A physical exam can reveal signs of ligament instability, and X-rays or an MRI may be used to confirm the injury. Treatment. Rest is essential in the short term, and surgical options, such as the T-plus surgery, are required to repair the ligament, especially if the injury is severe. Question 26. A 2-year-old beagle, Bella, has been diagnosed with a severe food allergy that results in gastrointestinal upset, including diarrhea and vomiting, as well as skin rashes. What diagnostic steps are typically involved in diagnosing food allergies in dogs, and what dietary changes should be made to manage Bella's condition? A. Intradermal allergy tests and blood work for parasites. The treatment involves an elimination diet and hypoallergenic food. B. Skin scrapings for mange mites and blood tests for bacterial infections. The treatment includes antibiotics and corticosteroids. C. Fecal tests for parasites and complete blood count. C. Treatment involves deworming and probiotics. D. X-rays and ultrasound to check for tumors. The treatment in chemotherapy and dietary changes. Answer A. Intradermal allergy tests and blood work for parasites. The treatment involves an elimination diet and hypoallergenic food. Explanation. Food allergies in dogs often cause gastrointestinal symptoms and skin issues such as vomiting, diarrhea, and rashes. Diagnostic steps. Intradermal allergy testing or blood tests can identify food allergies. A food elimination diet is often recommended to pinpoint the specific allergens. Treatment. Elimination diet or a hypoallergenic food can help manage symptoms by removing the triggers from the dog's diet. Question 27. A 9-year-old Persian cat, Oscar, has been diagnosed with osteoarthritis OA following signs of stiffness, reduced activity, and difficulty jumping onto furniture. What steps should be taken to diagnose the severity of Oscar's condition, and what are the treatment options for managing his osteoarthritis? A. Full blood panel and ultrasound to assess liver function. Treatment includes corticosteroids and rest. B. X-rays to evaluate joint health and identify any bony changes. Treatment includes NSAIDs, joint supplements, and weight management. C. Urinalysis and stool analysis to rule out infections. Treatment involves antibiotics and pain relievers. D. Physical therapy and blood tests for autoimmune diseases. It involves immune suppressants and anti-inflammatory drugs. Correct answer. B. X-rays to evaluate joint health and identify any bony changes. Treatment includes NSAIDs, joint supplements, and weight management. Explanation. Osteoarthritis OA is a degenerative joint disease common in older cats, often affecting the hips, knees, and spine. Diagnostic steps. X-rays are used to evaluate the joints and check for bony changes indicative of OA, such as joint space narrowing or bone spurs. Treatment. NSAIDs, non-steroidal anti-inflammatory drugs, are used for pain relief, and joint supplements, e.g. glucosamine, can support joint health. Maintaining a healthy weight can reduce joint strain. Question 28. A 5-year-old Scottish Terrier, Baxter, presents with difficulty urinating, straining to urinate, and blood in his urine. A urinalysis reveals struvite crystals. What is the most likely diagnosis and what are the appropriate treatment options? A urinary tract infection, ET. Treatment involves antibiotics and fluid therapy. B. Bladder stones, struvite. Treatment involves dietary changes and possibly surgery. C. Pyometra. Treatment involves spaying and antibiotics. D. Feline lower urinary tract disease, flood. Treatment involves anti-inflammatory drugs and stress management. Answer B. Blood at stones, struvite. Treatment involves dietary changes and possibly surgery. Explanation: struvite bladder stones are common in dogs and can cause signs such as difficulty urinating, straining, and hematuria, blood in the urine. Diagnosis: a urinalysis showing struvite crystals is diagnostic for struvite stones. Treatment involves a specialized dye designed to dissolve struvite stones, and in some surgery may be required to remove larger stones that do not dissolve. Question 29. A 7-year-old miniature schnauzer, Tilly, presents with excessive thirst, increased urination, and weight loss. Laboratory results reveal elevated blood glucose levels. What is the most likely diagnosis and what treatment options should be implemented? A. Canine diabetes mellitus. The treatment involves insulin therapy, dietary changes, and monitoring. B. Kidney disease. A treatment involves fluid therapy and phosphate binders. C. Cushing's disease. A treatment involves surgical removal of the adrenal glands and corticosteroids. D. Hypothyroidism. Treatment involves radioactive iodine therapy or thyroidectomy. Answer A. Canine diabetes mellitus. A treatment involves insulin therapy, dietary changes, and monitoring. Explanation: canine diabetes mellitus is characterized by symptoms like increased thirst, frequent urination, and weight loss due to the body's inability to regulate blood sugar. Diagnosis: elevated blood glucose levels confirm the diagnosis of diabetes. Treatment: insulin therapy is required to manage blood sugar, along with dietary changes to maintain stable glucose levels. Regular monitoring is crucial to prevent complications. Question 30, scenario-based. A 3-year-old golden retriever, Daisy, presents with a history of lethargy, poor appetite, and a slight fever. On examination, she has enlarged lymph nodes and pale gums. Blood tests reveal low red blood cell counts, anemia, and an elevated white blood cell count. What is the most likely diagnosis and what diagnostic tests should be performed to confirm the condition? A. Ehrlichiosis. A diagnostic test should include a Yeast for Ehrlichia, followed by antibiotic therapy with doxycycline. B. Canine distemper. The diagnostic tests include PCR for distemper virus with supportive care and antiviral therapy. C. Lymphoma. The diagnostic tests include a biopsy of the lymph nodes for histopathology, followed by chemotherapy. D. Leptospirosis. The diagnostic tests include urine culture, serology, with treatment involving antibiotics and fluids. Answer A. Ehrlichiosis. A diagnostic test should include a Yeast for Ehrlichia, followed by antibiotic therapy with doxycycline. Explanation: the symptoms of lethargy, poor appetite, fever, and pale gums, along with blood test results indicating anemia and elevated white blood cells, suggest an infectious disease affecting the blood. Ehrlichiosis, a tick-borne illness caused by the bacteria Ehrlichia, is a likely cause. Diagnostic tests. The PCR test is used to confirm Ehrlichia infection as it detects the DNA of the bacteria in the blood. Treatment: doxycycline is the antibiotic of choice for treating ehrlichiosis.